Hello everyone, this is Nishika. Welcome to my YouTube channel. This video is about drug profile of methotrexate. Methotrexate is a drug with multiple clinical uses. Methotrexate acts as anti-metabolite, DMARD, that is disease-modifying anti-rheumatic drug and anti-inflammatory drug. Now let's get into the topic. Methotrexate is one of the oldest and highly efficacious anti-cancer drug. Amitriptyline is the old name of methotrexate. It is a chemotherapy agent and immune system suppressant. It is invented by Yellaprakada Subbarao. Methotrexate is anti-metabolite class of drug that is used in the treatment of cancer, which includes breast cancer, leukemia, lung cancer, lymphoma, gestational trophoblastic disease, and osteosarcoma. Lymphoma is a broad term for cancer that begins in cells of the lymph system. Gestational trophoblastic disease is a group of rare tumors that develop during early stages of pregnancy. Osteosarcoma is a kind of bone cancer. Methotrexate is used as DMARD, that is disease-modifying anti-rheumatic drug, in the treatment of rheumatoid arthritis. It also acts as anti-inflammatory drug that is used in the treatment of autoimmune diseases like psoriasis and Crohn's disease. On higher doses, methotrexate is used for the treatment of cancer, and on lower doses, it is used for the treatment of autoimmune conditions like rheumatoid arthritis, psoriasis, and Crohn's disease. Anti-inflammatory drug works by decreasing inflammation that reduces pain and prevent long-term injury to the joints and skin. In the treatment of many types of cancer, it acts as anti-metabolite by slowing down the growth of cancer cells. Methotrexate is an FDA-approved folic acid antagonist indicated for the treatment of rheumatoid arthritis because of its high potency and efficacy. It can also be useful in patients with juvenile idiopathic arthritis. Juvenile idiopathic arthritis is the most common type of chronic, long-lasting arthritis that affects children, approximately 3.8 to 400 out of 1 lakh children. Let's discuss about the history of methotrexate. The history of methotrexate begins a few years earlier. In 1945, the American researcher of Indian origin Yellaprakada Subbarao first isolated folic acid from the liver in the laboratory of pharmaceutical company. In the same year, the researcher and his teammate also discovered a microbial source from which they subsequently synthesized folic acid. Methotrexate was first made in 1947 and initially was used to treat cancer as it was less toxic than the current treatments. In 1956, it was provided as the first cures of a metastatic cancer. Metastatic cancer is the spread of cancer cells from the place where they first formed to another part of the body. Methotrexate is on the World Health Organization's list of essential medicines. It is available as a generic medication. In the year 2021, it was the 132nd most commonly prescribed medication in the United States with more than 4 million prescriptions. The route of administration of methotrexate is of two ways. One is oral and the other is parenteral. Through oral, tablets and solutions are available. Parenteral includes intravenous, that is administered into veins, intramuscular, that is administered in the muscle, subcutaneous, that is administered beneath the skin, intrathecal is administered in the spinal canal or into the subarachnoid space, intraarterial, that is administered directly into an artery. Now let's look into the dose. 10 to 25 mg per week for psoriasis, that is in the treatment of psoriasis, methotrexate is given only once a week. 7.5 mg per week for rheumatoid arthritis, that is in the treatment of rheumatoid arthritis, methotrexate is given once a week. For the treatment of cancer, high doses of methotrexate is given. Folic acid is commonly co-prescribed with methotrexate to minimize the risk of adverse effects. Let's know about the mechanism of action. Folic acid is converted into DHFA, that is dihydrofolic acid, in the presence of dihydropteroate synthetase. DHFA is converted into THFA, that is tetrahydrofolic acid, in the presence of dihydrofolic acid reductase. Tetrahydrofolic acid is converted into thymidylate in the presence of thymidylate synthase. Thymidylate is converted into purine synthesis and purine synthesis converted into DNA. The mechanism of action of methotrexate is the dihydrofolic acid reductase enzyme is blocked by methotrexate and thymidylate synthase enzyme is also blocked, and hence thymidylate cannot be converted into purine synthesis and purine synthesis cannot convert into DNA. In pharmacokinetics of methotrexate, let's discuss about absorption, distribution, metabolism and excretion of methotrexate. Methotrexate is rapidly absorbed through GIT. Concurrent food intake reduces bioavailability of the drug in children but not in the adults. When methotrexate is given through oral route, peak level occurs in 1 hour. Dose of 30 mg is well absorbed through GIT. Methotrexate has broad distribution. It is widely distributed into the body tissues with highest concentration in kidneys, spleen, liver and skin. After absorption, methotrexate undergoes triphasic reduction in the body. First phase takes 0.75 hours and represents distribution of drug in the body. Second phase takes 2 to 4 hours and represents renal excretion. Third phase takes 10 to 27 hours and represents terminal half-life of the drug. Metabolism of the methotrexate is by liver and intracellular. Excretion is through urine. 90% of the methotrexate is excreted unchanged in urine within 48 hours by glomerular secretion and active tubular secretion. Drug interactions of methotrexate. There are many drug interactions related to methotrexate. Alcohol with methotrexate increases toxicity in liver and causes liver cirrhosis or liver dysfunction. Dipyridamole with methotrexate increases intracellular accumulation of methotrexate. Probenecid with methotrexate increases intracellular accumulation of methotrexate and decreases renal tubular function. NSAID with methotrexate decreases renal excretion. Penicillins with methotrexate decreases elimination of methotrexate and increases accumulation in the body and increases the risk of toxicity. Aminoglycosides with methotrexate reduces GI absorption of methotrexate. Theophylline with methotrexate decreases the clearance of methotrexate. Now let's look into the side effects of methotrexate. The common side effects of methotrexate are nausea and vomiting, megaloblastic anemia, gastric pain, loss of appetite, loss of hair, dizziness, difficulty in breathing. The other side effects of methotrexate are dark stools, blood in urine, irregular heartbeat, bone marrow suppression, low white blood cells, and on higher doses, methotrexate causes mucosal ulceration. Over a long duration of treatment, it causes liver damage. Contraindications of methotrexate. Methotrexate is contraindicated in hypersensitivity reactions to this medication. Pregnant women or breastfeeding women should avoid using methotrexate due to the elevated risk of teratogenicity and excretion into the breast milk. Caution is necessary for using methotrexate for patients who have pre-existing blood disorders such as bone marrow hypoplasia, leukopenia, thrombocytopenia, or significant anemia. In the case of rheumatoid arthritis or psoriasis, it is contraindicated to use methotrexate in patients with chronic liver disease, liver cirrhosis, or chronic liver alcoholism, alcoholic hepatitis. It is also not recommended to use methotrexate in active tuberculosis patients, HIV or AIDS, and renal dysfunction. Uses of methotrexate. Methotrexate is a drug with multiple clinical uses. It is used in the treatment of cancer that includes breast cancer, leukemia, lung cancer, lymphoma, gestational trophoblastic disease, and osteosarcoma. It is also used in the treatment of autoimmune conditions like rheumatoid arthritis and psoriasis. It is used to treat inflammatory bowel disease. To treat acute leukemia, that is a type of cancer of the white blood cells. Methotrexate is used in ectopic pregnancy. Ectopic pregnancy occurs when a fertilized egg grows outside the uterus. It is used in the treatment of Crohn's disease. Crohn's disease is a chronic autoimmune condition that inflames and irritates the digestive tract. Monitoring for methotrexate. Careful history and physical examination should be monitored regularly. Patients with increased risk of toxicity should be identified. Complete blood count and platelet count should be monitored regularly. Liver function test should be done. Liver biopsy can also be done in the case of hepatotoxicity. Serologic tests for hepatitis B and C should be done. Renal function test should be done regularly. Should monitor creatinine clearance to avoid possible nephrotoxicity. Monitoring for pulmonary toxicity. Methotrexate may also cause reactivation of tuberculosis in endemic countries, so tests for tuberculosis should be done to eliminate the presence of tuberculosis. Thanks for watching my video.